So hi, I'm Erin. I'm the founder of Thera VR, and I thought about making these little stories about, my journey as a psychotherapist becoming a startup founder. And I get a little nervous when I do these videos because I'm not been out of the public for a while, but I wanted to kind of stress the importance of where we are as a nation with the future of psychology. We are going to not just a dire time in our field, but we are still way behind in the science and the innovation for for therapy services. I wanted to share my story of how I used to work in the psychiatric ward with a 163 bed facility where we didn't even have enough beds for the kids. And what is important to remember is that this was way before COVID even happened. So the surge of child mental health issues, particularly in the state of California, it's really bad. And I got really burnt out. I was servicing hundreds of patients, outpatient, inpatient, and then on top of that, I got so burnt out from the medical model because most of the time they would just be over medicating them, and it wasn't really truly getting psychotherapy to them. And that's what most of these kids really needed, was just someone that they could really speak to and express themselves. Anyway, I couldn't really figure out what was missing. I couldn't figure out, why can't we improve mental health services? And as I studied the behaviors of my patients, they really, really relied on their technology. They really felt that using emojis and uh, certain apps was a way for them to express themselves truthfully. Now, when they saw me in person, it was a lot of malingering. They would just not be truthful because it's not something that they were comfortable with. And so I just came up with this idea, well, why don't I make the technology there for them, but use it as evidence-based care? Why don't I use the existing tools that they already are using, but let providers kind of integrate with that? So that was the birth child of Thera VR, is I wanted to see if, hey, if we could use a different platform for them to feel safe. And what I mean by safe, I mean psychologically safe. And that might allow them to actually, be more uh, open to really expressing what they're actually going through. Now, I proved this myself using my technology during COVID, and it was absolutely profound. The problem was that the existing organizations and institutions haven't adopted this yet. And this is where I want to get my story out to the public, is this doesn't cost a lot of money. The headsets are less than a cell phone. And what's unique about it too is it can be used in any state for cross-border counseling, either through remote patient access. But if it was used on site, like say in an emergency department, it would be ideal, because I know myself working in those departments, the patient suffers. They're stranded, they're left alone in a corner, there's no one there to hold their hand and do emotional deregulation. And it's quite terrifying for a child. But just going back to my story, is I want people to really know that even as a founder and having to go through the medical model myself, it is horrible. We don't have enough providers, but just even how the whole system is structured around these departments, and just the psych industry, they're really not truly focusing on healing. And that is what I wanted therapy VR to be 7 years ago. And now I think this is a crucial time, given that the government has withdrawn all the federal funding for clinical research and also just practical, mental health care services to kids in the school. I think this is a time where, if you are like maybe a nonprofit, or you're somebody out here listening to my story who is a doctor who actually really wants to try this in their hospital, I honestly really feel that if the more children that we can save and really connect with a real live person, not through a Zoom call, but through a different methodology of telecommunications, we're going to see a real serious comeback in improving patient outcomes. And as a scientist, I know that if I can get more providers to, try this and adopt it and share their feedback, I think that would really take TheraVR to the next level. And just with my story of like going through my own journey, and it's hard, like we don't have the support system as providers do, like with other professions. It's very taxing. It it's just the system is so broken right now. But as a provider myself and passionate about saving children's lives, I really do hope that someone hears my message out there that this isn't just VR, right? We're not some just tech company that is trying to make money or whatever. I'm at a point in my life where this is a little bit more about advocacy. This is about really changing the scope of asynchronous technology and improving this as a tool for pediatric mental health, right? There's other companies out there that are, geriatrics or exposure therapy or phobias or whatever. I'm trying to just really get to the core root of the issues that is going on with a child, and that is to focus on the adverse childhood experiences. Now, we know, or I know just through the, you know, the industry, that if we don't get the proper help to a child in the early stages, they carry that trauma later on in life, and it's already happening. So thank you so much for hearing my message, hearing my story. I'm going to try and post these little stories like, once a month to the public. And I'd love for you to subscribe, give me your feedback. What are your thoughts on all of this? Visit our website, www.theravr.io. And I encourage you, like, if you're a parent out there and you want to try this with your child, if they have a therapist already, we're giving this for free. If you want to just try something different than putting your kid on a bunch of Zoloft and Paxil, that's our business. You don't have to over medicate your child. And my hope is that if there's somebody out there that's listening to this story, this is the future of therapy for children. Anyway, thank you so much for your time, and please visit our website.